Hello, my name is Farida. I'm a psychologist and psychotherapist, and I'm engaged with Kairos Consulting. We will be talking about EMDR, or eye movement desensitization and reprocessing therapy. EMDR is a structured therapy that has been widely used to treat traumatic events or traumatic memories. And these days, EMDR is actively used to treat post-traumatic stress disorders as well. The history of EMDR started with Francine Shapiro. Francine Shapiro developed EMDR therapy methods in 1980s. The basic foundation of EMDR is adaptive information processing model. What is adaptive information processing model? Each individual naturally has ability to process even negative information that he or she is going to experience in life. Based on AP model, our brain has functionality to transfer with time all the negative memories into the more working schema. When the process of AP is disturbed and the emotions of traumatic event or the traumatic event itself is stored in our brain without being processed, in that case, we are using EMDR to help individuals to resolve the traumatic memory or to get rid of certain emotions and sensations associated with the traumatic event. To achieve this, the therapist is using bilateral stimulation, usually the eye movement. By stimulating both parts of the brain, we are able to process stored negative emotions, traumatic event, and try to help the brain to process information to build up the healthy network system. EMDR therapy is using different protocols to achieve the named goals. The therapy itself consists of the 8 phases. All the phases are directed to target the traumatic event, all the sensations and negative beliefs about the traumatic event. Based on the 8-phase protocol, the individual, together with the therapist, is able to integrate all the negative thoughts, sensations, and the traumatic event itself into more adaptive schema. The EMDR model is working in 3 dimensions: past, present, and the future. The role of the therapist is to integrate all these 3 dimensions during the therapy. This way, the therapist is helping individual to tackle the past memories, to bring them into the adaptive schema in the present, and to assist to build a positive future image. The therapist is working in all 3 dimensions. The therapist is helping individual to tackle past traumatic event and all the negative sensations and beliefs associated with that event. The therapist as well is integrating that negative experience and the traumatic memory into the present moment and tries to help the individual to build new sensations and belief system around the traumatic event. And the final stage is the future, how the individual is going to integrate the learned experience into the more general network or schema.